Imagine a small blister on your foot, something you might not even notice at first. For most people, it heals on its own within a few days. But for millions of Americans living with diabetes or poor circulation, that same small wound can quickly become a gateway to something far more serious. Deep infection, bone damage, and in too many cases, the loss of a limb. The truth is, lower extremity wounds are one of the most dangerous and most underestimated health challenges facing our community today. At Family Foot and Leg Center, we believe no one should lose a leg to a wound that could have been treated. We are Southwest Florida's most comprehensive lower extremity wound care specialists, and in the next few minutes, we want to share what we do, why it matters, and why the right specialist makes all the difference.
The numbers surrounding lower extremity wounds are startling. Across the United States, more than 37 million people are living with diabetes, and roughly 1 in 4 of them will develop a foot ulcer at some point in their life. Of everyone who undergoes a major leg or foot amputation in this country, 85% had a foot wound that preceded it, a wound that in many cases could have been caught and treated before it ever reached that point. 85% of diabetic amputations were preceded by a foot ulcer. More than 130,000 lower limb amputations occur annually in the United States due to diabetes. 26% of diabetics will develop a foot ulcer in their lifetime. The 5-year mortality rate after a major amputation can reach 70%. That last statistic deserves a moment of reflection. The 5-year mortality rate after a major amputation rivals the death rates of many common cancers. Yet, unlike cancer, this crisis rarely makes headlines. Wounds go untreated. Patients cycle through emergency rooms and primary care offices, receiving basic dressing changes, while the underlying problems continue to silently destroy tissue. Damaged nerves, blocked circulation, abnormal pressure, and spreading infection do not wait. Every day that passes without the right treatment makes the situation harder to reverse. When it comes to wounds of the foot and lower leg, not every specialist is equally equipped. Podiatric physicians complete 4 years of specialized medical school and a 3-year surgical residency focused entirely on the foot, ankle, and lower leg. That concentrated training produces a depth of expertise you simply cannot get from a generalist. One of the most critical and most overlooked aspects of wound care is biomechanics. The way you walk, the structure of your foot, and the pressure placed on different areas of your sole are often the very forces that create wounds in the first place. A wound that cannot breathe, that bears the full weight of your body with every step, simply will not heal. Our podiatrists are uniquely trained to assess these mechanical forces. They analyze gait patterns, foot structure, and digital pressure mapping to identify the exact cause of each wound and to correct it through custom orthotics, specialized footwear, bracing, and when necessary, surgical procedures such as tendon lengthening or bone realignment. Without addressing biomechanics, even the best dressing will only delay the inevitable. Studies show that patients who receive biomechanical correction alongside wound treatment have dramatically lower recurrence rates. Without that correction, wounds return in more than 65% of patients within a single year. Our podiatrists also bring specialized expertise in diabetic peripheral neuropathy, vascular assessment, and osteomyelitis, which is the bone infection that represents one of the most serious complications of chronic wounds. This combination of skills is precisely what the American Diabetes Association and the Wound Healing Society point to when they recommend podiatric involvement as a cornerstone of diabetic foot care. We do not simply treat the wound in front of us, we treat the whole picture that created it. At Family Foot and Leg Center, we offer the complete continuum of wound care, from the simplest procedures to the most advanced surgical interventions, all under one roof with the same team of specialists guiding you every step of the way. We begin where every wound care journey begins, with sharp and surgical debridement, which is the precise removal of dead, infected, and damaged tissue that allows healthy healing to begin. From there, our physicians select from a sophisticated menu of advanced wound dressings and bioactive materials, antimicrobials, silver-impregnated agents, specialized foams, and gels, each one chosen based on the specific characteristics of your wound. For wounds that have stopped progressing, we offer bioengineered skin substitutes and dermal matrices. These are living biological scaffolding materials that give stalled wounds the cellular signals they need to resume healing. When wounds require more intensive management, we employ negative pressure wound therapy, sometimes called a wound vac, which uses gentle suction to reduce swelling, draw the wound edges together, and dramatically accelerate tissue growth. We also coordinate access to hyperbaric oxygen therapy for wounds that need higher levels of tissue oxygenation to heal, particularly those involving impaired circulation or radiation damage. And when a wound requires surgical reconstruction, we are fully equipped to perform the full range of procedures, from split thickness and full thickness skin grafts to rotational and local tissue flaps, all the way to advanced muscle flap reconstruction. Muscle flap surgery represents the highest tier of limb salvage surgery. It uses vascularized muscle tissue to fill deep cavities, combat bone infection, and restore blood supply to areas that would otherwise face amputation. Very few practices in Southwest Florida offer this full spectrum. We do. And when your wound escalates, you will not need to find a new doctor. We are already your team. If you or someone you love has diabetes, please hear this clearly. Foot wounds are a medical emergency that requires specialist care, not watchful waiting. Diabetes can damage the nerves in your feet so thoroughly that you may not feel a wound forming until it is already deep and infected. Poor circulation slows healing, and elevated blood sugar impairs your body's ability to fight infection. What begins as a small callus or blister can become a bone infection in a matter of weeks. Research shows that diabetic foot ulcers that fail to reduce in size by 50% within 4 weeks of standard care carry a dramatically elevated risk of amputation. The single most important step you can take is to get to a specialist, not a generalist, as early as possible. Florida has one of the highest rates of diabetes in the nation, and Southwest Florida's aging population places our community at particularly elevated risk. At Family Foot and Leg Center, we have built our wound care program specifically to serve this community. We screen every at-risk patient, partner with vascular surgeons and endocrinologists to address the full picture, and provide the kind of early, comprehensive intervention that genuinely changes outcomes. If you have been told your wound is too far gone, if someone has mentioned amputation, we want you to know something important. It is not always inevitable. With the advanced technologies, surgical capabilities, and biomechanical expertise our team brings to every case, we regularly save limbs that other practices have given up on, limbs that other centers might never have attempted to reconstruct. We have seen patients walk out of our care whole when that outcome had seemed impossible just weeks before. What makes the difference almost every time is timing. The earlier a wound is seen by the right specialist, the more options are available, the more tissue can be saved, and the better the outcome. Do not wait for a wound to look worse before you act. Do not assume it will heal on its own. Do not accept a referral to a general wound clinic when specialized podiatric care is available to you right here in Southwest Florida. Family Foot and Leg Center is Southwest Florida's premier destination for advanced lower extremity wound care. We serve patients across Naples, Estero, Cape Coral, Fort Myers, Port Charlotte, Sarasota, and every community in between. Our board-certified podiatric physicians and surgeons are among the most highly trained specialists in the region, offering everything from same-day wound evaluations to the most complex reconstructive surgery available anywhere in Southwest Florida. You do not have to navigate this alone. If you or someone you love has a wound that is not healing, no matter how long it has been present, and no matter how many offices you have already visited, we are ready to help. Call us any time of day or night, 24 hours a day, 7 days a week at 239-430-3668. That is 239-430-3668. Or visit us online at www.naplespodiatrist.com to meet our top doctors, learn about our services, and schedule your appointment. Same-week appointments are available across our multiple Southwest Florida locations, because when it comes to a wound that will not heal, every single day matters. And we are here every single day for you,